Доброго дня.
Good evening, good afternoon, our esteemed speakers and guests of this event, and our journalists and press, really, who I witness actually this live transmission. So, Ukraine Christ Media Center is embarking upon its working day. So, on behalf of the WHO regional office for Europe, so I would like really to hand over to moderator of the event. So, Mr. Babu Pant.
And good evening, and welcome to this WHO press briefing from the Ukraine Crisis Media Center here in Kyiv. We are going to give you the latest update on our work in Ukraine, our concerns for the winter in light of the energy crisis and the ongoing health needs and impacts of the war, particularly in the south and east of the country. Our distinguished panel includes WHO's Regional Director, Dr. Hans Kluge, and WHO's representative in Ukraine, Dr. Jarno Habicht. Journalists joining us in the room, you guys can ask questions to our panel when the time comes by raising your hands, and we'll get a mic over to you. For journalists joining us online, please do raise your hand in the system when the time comes to ask your question. Simultaneous Ukrainian translation is available here in the room, but unfortunately not online. And finally, just to flag, should an air raid siren begin and we are required to evacuate to a shelter, we will have to pause this press briefing and attempt to resume it online once everyone is safe in the bunker. And we thank you for your patience and understanding. So without further ado, I'd like to give the floor to WHO's Regional Director for Europe, Dr. Hans Kluge. You have the floor.
Dobry wieczór, good evening from Kiev. This winter will be life-threatening for millions of people in Ukraine. The devastating energy crisis, the deepening mental health emergency, constraints on humanitarian access and the risk of viral infections will make this winter a formidable test for the Ukraine health system and the Ukraine people, but also for the world and its commitment to support Ukraine. The country is facing a therma crisis on top of a perma crisis, brought on by the war and the pandemic. Half of Ukraine's energy infrastructure is either damaged or destroyed. This is already having knock-on effects on the health system and on the people's health. Put simply, this winter will be about survival. WHO has so far verified 703 attacks on health since the war began 9 months ago. This is a clear breach of international humanitarian law and the rules of war. Continued attacks on health and energy infrastructure mean hundreds of hospitals and healthcare facilities are no longer fully operational, lacking fuel, water and electricity to meet basic needs. Maternity wards need incubators. Blood banks need refrigerators. Intensive care beds need ventilators, and all require energy. To focus the world's attention on this situation is why I'm here on my 4th visit this year, and just days after the largest wave of missile strikes across the country, to meet officials, health workers, patients, civil society, and offer WHO's unwavering support to the Ministry of Health, to the government, and to the people of Ukraine. And to express my gratitude and respect for the Ukraine's doctors, nurses, and other health workers who continue to show their heroism. What we know is that hundreds of thousands of premises across the country, including private homes, schools, and hospitals, have no gas supplies, essential not only for cooking, but also for heating. Today, 10 million people, a quarter of the population, are without power. Cold weather can kill. Temperatures are predicted to plummet as low as minus 20 degrees Celsius in parts of the country. As desperate families try to stay warm, many will be forced to turn to alternative heating methods, like burning charcoal or wood or using generators fueled by diesel or electric heaters. These bring health risks, including exposure to toxic substances, that are harmful for children, older people, and those with respiratory and cardiovascular conditions, as well as accidental burns and injuries. We expect 2 to 3 million more people to leave their homes in search of warmth and safety. They will face unique health challenges, including respiratory infections such as COVID-19, pneumonia and influenza, and the serious risk of diphtheria and measles in under-vaccinated populations. All of this is taking its toll on the mental health of the people of Ukraine. This week, the war enters its 9th month, and already some 10 million people are at risk of mental disorders such as acute stress, anxiety, depression, substance use, and post-traumatic stress disorder. By training healthcare workers on how to provide mental health services, WHO has so far reached, together with the Ministry of Health, 1,400 people with severe mental health conditions across Ukraine. Tens of thousands of psychosocial support and mental health consultations have been held for healthcare workers and the general public, including mobile mental health teams who go out to the community to offer care. This would not be possible without the tireless support of the First Lady, Her Excellency, Ms. Olena Zelenska, whom I thank for our meeting earlier today. I have also met with the Prime Minister, His Excellency, Mr. Denis Shmihal, and the Minister of Health, Dr. Viktor Lashko, with whom I discussed energy supply, preparing for the winter, and perhaps most crucially, meeting critical health needs in both newly regained and occupied areas. And this brings me to my next point, humanitarian access. The war has impacted both access to healthcare and supply lines for the flow of humanitarian aid. Ukraine needs sustained resources to see the health system through the winter and beyond. Points that will be high on the agenda at next month's Ukraine conference in Paris under the leadership of President Macron and President Zelensky. I am very concerned for the 17,000 HIV patients in Donetsk who may soon run out of critical antiretroviral drugs that help keep them alive. I am urgently calling for the creation of a humanitarian health corridor into all newly regained and occupied areas. WHO and our partners are ready to mobilize at the moment's notice. I reiterate my call on both parties to allow urgent humanitarian access to meet people's health needs. Access to healthcare cannot be held hostage. Finally, let's not forget that people are more likely to acquire viral respiratory infections in the winter than other seasons. Like in the rest of Europe, the many subvariants of Omicron are already circulating in Ukraine. However, with low basic vaccination rates, let alone boosters, millions of Ukrainians have waning or no immunity to COVID-19. Couple that with an expected surge in seasonal influenza and difficulties in accessing health services, and this could spell disaster for vulnerable people. We are helping Ukraine's health system prepare for the winter. This includes emergency repairs to health facilities, heating infrastructure, and energy maintenance. We are also providing prefabricated structures in newly regained areas, portable heating devices with fuel, survival blankets, diesel generators, and ambulances. Ukraine's health system is facing its darkest days in the war so far. Having endured more than 700 attacks, it is now also a victim of the energy crisis. It is being squeezed from all sides, and the ultimate casualty is the patient. In the short term, we must find practical solutions that allow healthcare services to continue through the winter as best as they can. But this is not a sustainable scenario. This war must end before the health system and the health of the Ukrainian nation are compromised any further. Дякую. Thank you.
Thank you very much, Regional Director Dr. Kluge. Let's go straight to Dr. Jarno Habicht, WHO's representative in Ukraine and head of our Ukraine country office. Dr. Habicht, you have the floor.
Thank you, Harno večera. Thank you, Hans. During last week, WHO teams were able to enter Kherson with life-saving medical supplies to treat people in the city and the community. And we continue to bring essential supplies as of today as well. Today our team was there together with the rest of UN, and what we as WHO delivered was medicines and equipment to provide consultations, to provide support for around 100,000 people in the months to come. And this complements what WHO has been doing already, including the surgical supplies, generators, medicines, especially for chronic diseases, as since the 38 settlements have been regained and accessible. Similar to what we have observed in the newly regained areas, the population is expected to be elderly with chronic conditions including stroke, cardiovascular diseases, and diabetes. Thus, the demand for medical services is high, and as the winter starts, and due to the infrastructure damages very much needed, there are fewer health facilities functioning and operational due to the disruption of critical infrastructure, including water, electricity, and a number of evacuations have taken place. As Regional Director noted, a major priority for WHO in Ukraine is to ensure continuous flow of humanitarian support, and we coordinate that closely with authorities at the local level and with the Ministry of Health. Since February 24, we have delivered more than 2,000 metric tons of medical supplies in coordination with authorities, including Ministry of Health. Lately, areas like Izum, Kharkiv, Balaklia in Kharkivska Oblast have been ones where we have delivered, including the generators, medicines, trauma kits, and much more. But in addition to humanitarian support, WHO is working on a number of programmatic areas to ensure that there is a continuation of public health work and support. Let me share a few of the examples. Together with the Office of the First Lady and the Ministry of Health, we have trained healthcare workers with stress management techniques to strengthen the provision of mental health services across the whole country. And we have agreed a coordinated way forward for developing mental health services, as well providing trainings. And this we have done last week with 15 different partners. We have also ensured that population has access to timely vaccination through COVAX mechanism, together with our partners like UNICEF, as well as a number of member states. Millions of COVID-19 vaccines have been delivered in the past few months to ensure that the vaccination program can restore and reach out, especially to the vulnerable groups, that they have available their first round as well booster vaccines. WHO also has supported the mobile health units to ensure access to care and the continuity of care, especially in the remote areas of Ukraine. This is important for chronic disease management and addressing the non-communicable diseases, including hypertension and diabetes. But also, we have continued to train thousands of healthcare workers across the range of topics, including trauma care, mass casualties management, managing chemical exposure, epidemiology, and laboratory diagnostics. And it is important because it allows those healthcare workers to bring extra energy and knowledge to provide care to people. Our regional director mentioned winter, and this has been in the center of the current mission. It will provide formidable challenge to the health system. And all of us have witnessed snow, which has come. Usually we celebrate the snow and winter coming, but this winter will be different. Continuous attacks to the health infrastructure have also impact to the health services available and the health system. Access to health services has been already impacted. We know that from our recent survey that 1 out of 5 persons have challenges on accessing medicines. In the occupied territories or where the hostilities happen, this is 1 out of 3. So medicines are not so accessible. But without electricity, the machines in the intensive care units stop working. Surgeries can't be continued. And cold chain facilities needed for vaccines and medicines will be disrupted. One can only imagine what would be the impact for civilians across the whole Ukraine. Until now, the health system has demonstrated resilience, as many Ukrainians, and has continued to provide care in the dire circumstances we have. But now, the stress test ahead of us in the coming months is something that nobody has witnessed before, in the last 9 months of war including. We continue to support as many partners. In the health cluster, where we have more than 150 partners, many partners are supporting also to have available generators. As a health cluster partners until November, more than 400 generators have been distributed across the whole Ukraine. In all the oblasts have delivered some of the generators. Lastly, my gratitude goes to authorities, health leaders, and many partners on the ground for continuous work and support to provide health care to the population. WHO stands alongside to all of you as we witness the power cuts. I think everybody across Ukraine is witnessing power cuts and knows what it means in our homes, but also services to be available. I often hear stories from doctors and nurses who have witnessed unimaginable situations and at the same time have continued to provide care. I have been talking to a number of doctors who are willingly staying behind to continue to provide the services. And they are our heroes as we go through the war. And I hear heroic stories from volunteers who are taking extra steps to support the people in Ukraine. My deepest respect and thanks goes to all of you as you support the health system to continuously provide services and as we support Ukraine to go through the winter. Thank you. Дякую.
Thank you very much, Dr. Habicht. So with that, we can open the floor to questions from the press, and we can start with the room here. And if you're online, please do raise your hand and ask your question of the panel. But for now, if we can go to, please introduce yourself when you ask your question. Thank you very much.
Of course. Jessica Parker from the BBC. I just wanted to ask Dr. Kluge, you outlined a number of very serious health emergencies. Which do you think is the most acute? Which do you think is the most serious? And you also talked about coronavirus, COVID spreading in some communities. What evidence do we have at the moment of that being an issue as we head into winter? And also, if I may, just a quick final one. I mean, from what you say, many lives are at risk, not just from the conflict, but the health repercussions of the conflict. What more does the international community need to do about this? Thank you.
Thank you. This has to do directly with the objectives of my mission, which is one on the winterization, because that's the acute. And then the second one is to provide the essential health services. So I would say that with 50% of the civilian energy infrastructure being damaged or destroyed, at the moment, that there is a onset of a brutal winter where temperatures can plummet down to minus 20 degrees, that this is to be considered as the largest attack on healthcare on European soil since the Second World War. And we don't know about what's coming. From what do people die from the cold? Mainly from stroke, from heart attack, and from respiratory infections. So for people, it's very important if they have feelings of numbness in the toes or the fingers, or there is a pale spot on the skin, that people have to watch each other also to not to get the skin further being cooled down. This, of course, in addition to direct trauma, which of course is still there in the country. In the newly liberated territories, there the big challenge is, because there's quite some elderly population, what we call non-communicable diseases. These are chronic diseases. Diabetes, hypertension, chronic respiratory infections, for which we do have the tools. But we just spoke to a group of volunteers who is delivering medical supplies to so-called grey zones. And in the liberated areas, there are no pharmacies. There is no any primary healthcare center which is functioning. So there, together with the Minister of Health, we're trying to fill a gap with mobile teams. Now, on the COVID-19, we have to extrapolate from what's happening in the European region, where we see, due to winter seasonality, combined with a soup of Omicron subvariants, that there will be an increase. And here, the booster is very important for the vulnerable people. The challenge is that for this, you need a very strong surveillance system. I will see if Jarno can say something more specific on the communities, but if the surveillance system is not strong enough to detect the incidents and new variants, it's very difficult to say something. We can refer, of course, when I was here before the war started in January this year, only 1 out of 3 Ukrainian people are vaccinated for the COVID-19. And that was at the time that the vaccination was being scaled up.
Thank you. I will just add on COVID-19. What we have been observing, and also the visits to the facilities, we see currently the COVID-19 cases going down, so decreasing. But we saw the peak around 4 to 6 weeks ago, where number of cases. And the second, what we all aim is really to ensure that the vaccines are available. So what we know is we need to have 3 things to close the pandemics, we know. First is very good surveillance system, as the regional director said. And Ukraine is using Sentinel surveillance to monitor what is the situation, as well collects the information from the facilities. Second is vaccination. That's most important, that we ensure that the vaccines are available. And that's why the COVAX facility, where we have vaccines available, plays a critical role, and the vaccines are distributed across all the oblasts to have that available. And the third, very important, is to ensure further preparedness. And that's why Ukraine is relying a lot on the regional CDCs, and the work has been starting very well with them to ensure that we monitor the situation in each of the oblasts.
On the question on the international support, I would say on one hand, the international community to help to get humanitarian access to the occupied territories, what's happening in Mariupol, what's happening in Donbass. We know 17,000 people with HIV in Donetsk alone, going to run out of treatment. I mean, this is an unacceptable situation, really. This is one thing. And the other thing, looking a little bit further, is budget support. Because Ukraine is going to face, tremendous economic crisis. And the salaries of the healthcare workers need to be paid, and the medicines need to be paid. So it comes back to the basics.
Thank you very much for that. So, are there any questions in the room or online? Please let me know, or by raising your hand. I think, is there a question here in the room? Is this in Ukrainian or in English? Okay, my apologies. Right, okay, well, if there are no further questions, we can wrap this press conference up. Thank you very much for your time. If you have any further questions or follow-ups, please email us at eupress@who.int. Thank you for joining, and stay safe.